Let's go into a little bit further etiology of constrictive. Importantly, frequently tested constrictive pericarditis prior irradiation to chest, and that's important. So, if your patient, and even to this day, with cancer and chemotherapy and such, or radiotherapy, then you might introduce enough damage inadvertently in which now you end up developing constrictive pericarditis, Hodgkin's disease, breast cancer. Now, if it's tuberculosis, almost any disease that causes acute pericarditis, stop there. Acute pericarditis, what does that mean? Rapid accumulation of fluid within the pericardial cavity may result in pericarditis, granted. With that increased inflammatory, you have now developed or introduced damaged. Over a period of time, what may then happen? Well, enough fibrosis or calcification, we have now gotten into constrictive pericarditis. So any cause of acute pericarditis. For example, let me give you another analogy. Who's this patient? Hey, doc, I have pain. Where? In my stomach area. Okay. Tell me about this pain. Every once in a while, I feel like the pain is, I feel it in the back as well. Really? What's your number one differential? What organ has been affected? Pancreas? Sure. Epigastric pain radiating to the back. And alcohol? And you find that your lipase is elevated? Most likely, acute pancreatitis. But if you have recurrent acute pancreatitis, do you call this, is a diagnosis, recurrence of your acute pancreatitis? No, you would then call it chronic pancreatitis. Same concept. When you have acute pericarditis and you have enough damage over and over again, doesn't that lead into chronicity? Well, you don't call this chronic type of pericarditis. You would then call this constrictive because of enough fibrotic and calcification taking place. Other infections involve radiation we just talked about. Breast cancer and Hodgkin's are huge. Neoplasias, rheumatoid arthritis, and trauma. So any cause resulting in acute pericarditis may result in constrictive.